So if we think for just a moment, we've talked already about engagement, but it's interesting to just reflect for a moment, what does engagement mean to you? And I'd invite you to jot down just the first few words that come to mind. And I think if we were able to hear from everyone on this webinar, there'd be a lot of variation about what engagement means. And in fact, if you did a Google search, and I did this not too very long ago, 9.8 million results. And when you start to look at some of those, and no, I did not look at all of them, but there are a lot of different definitions out there. And I think depending on your role in healthcare and what your actual job is in contributing to the care system, you might have a different impression. So if you're an administrator, you might consider that engagement, good engagement would be to follow through with paperwork or keep an appointment. Or if you're in the hospital, engagement might be to follow the guidance of caregivers and to participate in discharge planning. Maybe engagement means following some rules, like going to see the general practitioner before seeking urgent care. Or maybe it's taking medications as prescribed. Or maybe it's reading educational material someone gave you that would be of benefit to your health. Maybe it's signing up for a portal. So again, it really could be just about any and all of those things. And in the broadest context, it's really about engaging people in more healthful behaviors and decreasing less healthful ones. So again, the takeaway point here is that engagement is broad, and when we talk about it, especially at our organizational level, we need to be clear about what we mean and what parts of engagement we really feel are important. And so for the rest of this webinar, we're going to explore some attributes of engagement that are important as we think about our roles in helping British Columbia achieve that triple aim: improved patient and provider experience, and improved health outcomes at a cost we can afford. So, as is often, we start with a definition. And this definition is from Coulter, and the definition reads: the relationship between patients and healthcare providers working together to promote and support active patient and public involvement in health and healthcare, and to strengthen their influence on healthcare decisions at both the individual and collective levels. Well, that's a mouthful. And that is really a process that brings people together. And there's a couple of portions of this definition that I would like to highlight. So the first really talks about supporting patients and public involvement in healthcare. In order for people to be involved, they need to have knowledge and awareness. They need to have information that's provided in a respectful way and provided in a way that they can understand. But this definition is more than just awareness and education. It's really about taking action. And so for some, if they know what's best for them, they'll be able to just do it on behalf of their health. And for others, as we've just talked about last time, we may need to take a stepwise approach. We may need to work harder to engage people in their health and support them to take action. And that also involves supporting the system in which they receive care. If that system is welcoming and well-designed and meets their needs, they're much more likely to continue to engage. I also want to be clear that there are some things that we're not talking about. So when you look in the literature or you search, you'll see patient experience, patient confidence, patient activation, and patient satisfaction. And they're all related to engagement, but there are a couple of things that I want to be clear that are not, and that would be patient adherence and patient compliance. And so what we're talking about is not that the patient obeys us. It's not that they adhere to our treatment plan or they comply with what we're asking them to do. Engagement really is working together. It's a willful and active participation in health, and it's really directed by the patient. So just to be clear, that's what we're talking about here today, that type of patient engagement.